biggest, the biggest concern parents have is sometimes not even the doctor operating anesthesia. You operate at some of the finest hospitals in the city, and I'm sure you have very good anesthesia people. Have you heard any real major risk when you have a good anesthesiologist the other side of the table with you today?
Anytime a child has anesthesia, general anesthesia, there's always a potential risk for catastrophe. Fortunately, that happens very few and far between. The American Academy of Anesthesiology quotes that 1 in 250,000 people will die of anesthesia unexpectedly. When you extrapolate that to an otherwise healthy child for a relatively short procedure, it's probably even less than that. But the truth is, when it's your child, even that seems like too much. Fortunately, I have personally never seen any such catastrophe because in the hands of skilled anesthesiologists, this usually does not happen. But once in a while, unfortunately, you hear about it. When it happens, it's so infrequent that it's usually in the newspaper or on the news. So it is a cause of concern, and for that reason, we should never take anesthesia cavalierly. But if you operate in a place where they have good, skilled anesthesiologists who have a lot of experience, either with particular training in children, or at least have a lot of experience with putting children to sleep, chances are that child is going to do very, very well.
My impression, pediatric subspecialists in the surgical field are very selective who they use on the other side of the table because they don't want to have any problems. Is that true?
Absolutely. Nobody wants to hear the surgery went well, but the anesthesia didn't, and there's subsequently a big problem. So no surgeon can be successful without a good anesthesiologist. I tend to work with only few people. I've been working at the New York Infirmary for 15 years, and I have developed a rapport with several anesthesiologists who I feel very comfortable with. 2 of them have had actual pediatric training like myself, but 2 of them have not. But over the years, they've done this operation, or the anesthesia for this operation, so many times that I feel very comfortable with them. In any hospital, a surgeon has to feel comfortable with the anesthesiologist, and the recommendation I would make is that if you don't know the anesthesiologist in your hospital and you're operating on small children, you should have someone who has had a pediatric anesthesia fellowship. Once you've developed a rapport with certain anesthesiologists who may not have had that fellowship can still be very good and very qualified, but you should never be using an anesthesiologist for the first time that you don't know that you feel uncomfortable with, because if you don't feel comfortable, then the parent is not going to feel comfortable, and if something goes wrong, you'll feel that it was your problem, and it is your problem. So it's your job to make sure that you're working with an anesthesiologist who you feel comfortable with.
All it takes is one bad situation, so I think most pediatric subspecialists in the surgical field are very, very careful who they pick to the other side of the table. Is that true?
Absolutely. Even aside from catastrophes, just in the general flow of a surgical case, people who are not comfortable with children might be a little bit more traumatic with the way they handle the child in terms of their teeth, in terms of inserting a breathing tube. They have to know just the right size. They have to know how to insert it gently so that there's no trauma to the voice box. Also, just the handling of the child, I think it's a big difference. The handling of the child as they're putting the child to sleep. We have a parent in the room with the child as the child's going to sleep, and you can tell the difference between an anesthesiologist who has skill and has concern and has compassion for that child and that parent, understanding it's a very traumatic episode and putting that parent at ease. There are some anesthesiologists who would rather not have a parent in the room because they don't feel that comfortable with the situation, and they're really not able to empathize with the parent and the child.